Hello, thank you for joining us today. I will be leading a professional interview for the new graduate registered nurse role on the Cardiac Progressive Care Unit. This unit provides care for the patients recovering from acute cardiac events, experiencing worsening heart failure, receiving continuous IV medications, or requiring continuous cardiac monitoring. This new role demands a great deal from a new graduate nurse in terms of assessment ability, confidence in interpreting cardiac rhythms, and emotional resilience to address a patient population in which health status may deteriorate rapidly or unexpectedly. I have worked on this unit for approximately 4 years, and I can tell you that the technical aspects are important, but they are only part of the skill set of a successful nurse. We must also rely on strong clinical judgment, the ability to sense when something is amiss beyond what our cardiac rhythm is showing us, and the courage to advocate for our patients regardless of how much experience they have. During this interview, I'm seeking a glimpse into how the individual thinks and performs under pressure and how they assess their own knowledge and skill. New graduate RNs experience a considerable learning curve when starting work in a high acuity specialty area such as this unit. And I consider the importance of this factor throughout the interview, beginning with a focus on building trust early on in the nurse-manager relationship. A new graduate nurse, even with strong academic performance, may still enter a high acuity area feeling ill-prepared to deal with the fast pace and acuity of patient needs. During this interview, I do not only want to ensure the nurse has clinical knowledge to work on the unit, but also that they know enough about themselves to be honest about their current capabilities and limitations and be open to learning and growing. I have designed this interview with questions focusing on 4 areas: clinical expertise, clinical judgment, technical expertise, and self-awareness. I also ask one question focusing on communication and collaboration, as this unit cannot thrive if individual nurses are not working together as a cohesive team. Questions focused on clinical experience will elicit specific examples from the nurse's clinical practice and ask her to describe her role and involvement. Questions focused on clinical judgment will present her with scenarios to assess her ability to recognize problems and implement appropriate interventions. Technical expertise questions will test the nurse's knowledge of fundamental skills. Self-awareness questions will, the most difficult to answer correctly, are the most likely to identify a nurse with accurate self-assessment. The candidate featured today for this new grad registered nurse role, his name is Worley Philippe, newly graduate nurse from a nursing school in our local area. He's eager to start, he has great ambition, and we're going to see how his interview skills are. Hello.
Hi. Hi, my name is Worley.
Hi, my name is Vaughn, the clinical nurse manager. Nice to meet you.
Nice to meet you. Thank you.
Thank you for taking time out of your day to come and interview for this new graduate registered nurse role. I did receive your resume. I looked it over with some of the members of the leadership team. We decided to bring you in for an interview to see how well you interview. What do you have to say about your practice, your profession, and how it went? So I know that you don't have much experience on the clinical floor as a nurse, but you do have clinical experience. So a lot of my questions will be, your responses will be coming from your clinical experience, okay?
Okay.
So tell me a little bit about yourself.
Well, my name is Worley. I recently graduated from nursing school, and I was just interested in being hired here on this cardiac floor.
We're just going to jump right into this interview, okay? Tell me about a time in clinical when your patient's condition changed rapidly. What were the first signs you noted? And tell me, what did you do?
Well, in my clinical, I did work on the med-surg floor where a patient became more short of breath within the first 20 minutes when I arrived. The first thing I noticed was that her oxygen was decreasing. So I went in, listened to her lungs, making sure that I did not hear any crackles, any adventitious lung sounds. Then I called my preceptor. The patient went on oxygen, the provider was notified, and within an hour the patient was fine.
Well, that's a great answer, really, because you've seen a pattern, you've viewed the numbers, Patient didn't even have to verbalize a complaint, but you took action. You were self-motivated to do that, and you didn't sit around and wait for something to happen. You took action right away, so we really like that. You were able to trust your gut instinct. You went and got your preceptor. Sometimes as a novice nurse, we have trouble going to get help or letting someone else know, hey, I don't know what's going on, but something is going on, and that's what we need now. You know what I'm saying?
Right.
So I think that was a very good action that you took. So really, question number 2 here. You're working on a telemetry unit, and your patient suddenly develops new onset chest pain and hypotension. Tell me, what are your first 2 minutes?
So I would not walk out of the room. I would call for help while I'm inside of the room. I would take a full set of vitals, ensure that the patient is on the monitor, and make sure there's any, if I can spot any issue that is causing it, like infiltration of the IV, any reaction to the medications maybe. I would want to know if the patient is in the same kind of pain as when she arrived. So if it is cardiac or if it's another issue. I
like that answer. It's pretty good. I'm glad what I was looking for and you gave to me was the fact that you're not leaving the room. You don't leave the bedside of the patient. You stood there, you're trying to figure out your H&Ts, why, what's going on with this patient. Is it something that's reversible? Is it something that we can fix? You're using your own clinical judgment and independently. And so I know that eventually, you will have to get help because there's something going on. You need the doctor, you'll need your preceptor, but I can appreciate the fact that you took the time to identify something was going on and you reviewed with yourself, what could I do to fix this problem? So that was a very good answer.
Thank you.
Our next question. So Rory, explain what changes in the ST segment represent on a patient's monitor and what your initial intervention would be.
So ST segment elevations typically represent the patient is having an MI, and an ST depression represent that the patient may be ischemic. The first thing I would do is make sure on the monitor that it's not an artifact. I would check on the wires to make sure that they're placed properly, and then take a look at the patient physically to see whether they're okay or if they're in distress. After I would put the 12 lead on, call the provider, and prepare to take any action because time is everything here.
Yeah. See, I like that answer because you didn't just give me a textbook answer. You recognize that artifact needed to be rolled out.
Right.
The first thing you do is you check your patient. You check your leads because it sometimes can be just the movement of the patient, But I'm glad you caught on to that one. You checked your leads, you checked out what we could fix, and then you realize, okay, is it the patient? Is it something physiological going on with the patient? That was very good, really. So our next question, really. Now, really, my next question is going to be more of a self-awareness question. Okay. So, tell me, what is one thing that you would like to see improvement on in your clinical practice, and what are you doing to address that?
I would say EKG interpretation. Outside of the common rhythms, some of them are harder to read and are a little more difficult. I've been pulling them from practice books and reviewing those as much as I can. I've been asking my preceptors to go over them with me, but yeah.
Now, I can appreciate that answer. That was a really honest answer because you have experienced nurses that won't even admit that, hey, I struggle with reading these rhythms. They'll see, go across the monitor and go, oh, normal sinus rhythm, hey, oh, I think that's a PVC. And it's actually something, it's actually not. It was a good question, a good self-awareness assessment. You recognized the weakness that you have, and you have, in fact, put a plan in place to help yourself perfect that. So I think that's very good.
Thank you.
Our next question, Worley. So Worley, tell me, why cardiac specifically? Do you understand the emotional aspects that come along with caring for the critically ill and dying?
Actually, yes. So my grandfather had heart failure. I saw the nurses caring for both his body and our fear of him dying. That's what brought me to cardiac. I do understand we lose patients. That's hard. I'd rather do hard things that are asked of me than anything that isn't.
I understand. Oh, that's very good. That's very good. I see that you don't have an unrealistic expectation about this specialty. It's all because it's very important. It's one of the biggest reasons why new nurses burn out early on units like this. And I see you have personal motivation for choosing this specialty. So I feel like you'll be a good fit. You'll fit in. You have the drive. You have the motivation. You're seeking the knowledge. So you have very good qualities. You have good things going on here. Our next question. So Riley, my next question. I want you to tell me about a time that you disagreed with someone on the care team, a provider, an experienced nurse. Tell me, how did you handle that?
Yes, so actually doing my preceptorship, I thought something didn't look right. A patient was being discharged and the patient was in distress. They told me that they were not able to breathe. And so at first I went to the doctor, explained everything, and they told me, oh, well, I was in the room 5 minutes ago, so the patient was fine. It's okay, just let them go home. However, I didn't feel comfortable with that, and so I went to my preceptor, told them about what I had observed. We went to the room together and assessed the patient, and it turned out that the patient was in respiratory distress, and so we escalated the situation from there. And so I realized that I do have to say something, even if someone else do not agree with my assessment.
That was the exact response that I wanted to hear. You have to have confidence in your clinical practice. You have to advocate for your patient, because what you did was you prohibited unsafe discharge. That patient could have suffered harm, could have suffered injury once leaving our hospital. So I appreciate how although it was challenging as a newer nurse, not with much experience, you stuck to it and was like, listen, I'm going to escalate this. You went to your preceptor, and you guys did what you had to do to make sure the patient was safe. I thought that's very, very good. So really, I appreciate your strong skills that you have, what you were going to bring to our unit. Great job with advocating for patients. Great job with your problem resolution skills. Great job with your self-awareness. Your self-awareness, that really grabbed me, because I still, we had an incident with someone that was unable to recognize their rhythms, and that was their weakness, but they were just unable to share, to acknowledge that, hey, this is another weakness, and let me reach out to get help. I thought that was very good. You did really well in your interview here today. So you will hear from someone from our leadership team regarding the follow-up, the next steps, and what we'll do after that. Do you have any questions for me?
No, I think that's it.
Okay, you did a good job. I want you to keep growing, keep doing what you're doing. You're going to be an awesome nurse. And I hope you'll be a great addition to our team.
Okay, thank you for this opportunity.
Thank you so much. You have a great day.